Hello everyone, my name is Timotaya Ojo, and I'll be presenting a health promotion teaching plan to decrease readmission to the hospital of African American patients with congestive heart failure. So a little bit of background. According to the American Heart Association, a new study has shown a decrease in hospitalization due to heart failure. However, African Americans are admitted at a higher rate than other ethnic and racial groups. When hospitalized for heart failure, African Americans have a 45% greater risk of death or decline in functional status than whites. The higher percentage of cases in heart failure in African Americans is attributed to modifiable risk factors such as hypertension, hyperglycemia, left ventricular hypertrophy, and smoking. Learning needs assessment. For this learning needs assessment, it's done by completing a survey or in-person interview for the African American patients who have been diagnosed or hospitalized with congestive heart failure. Part of the learning needs assessment involves asking the question to determine their knowledge of the diagnosis, knowledge of prescribed medication regimen, including the dosages, as well as knowledge of non-medical treatments, such as diet, knowledge of their prognosis, and further questions will address the education level of the patient to determine best methods for teaching and education. Health promotion model. The precede, proceed framework was used for this teaching. This model has a planning phase, a setting up phase, and an evaluation phase. In the planning phase, it's important to assess social, environmental, epidemiological, and educational areas in order to determine the best desirable outcomes. In the implementation and process phase, interventions are initiated and completed in order to achieve the desired outcomes. Finally, in the evaluation phase, we assess the efficacy of our interventions and determine whether or not these interventions or treatments were effective in achieving our desired outcomes. The goals of this model are to explain health-related behaviors and environments, and to design and evaluate the interventions needed to influence both the behaviors and the living conditions that influence them and their consequences. Health promotion, health education plan. The goal is to decrease readmission to the hospital of African Americans with congestive heart failure. In order to do this, we use and understand standard therapies such as medications to control heart failure symptoms. We also do this by providing information and education that is reviewed with a nurse educator using the teach-back method before discharge. This teach-back method includes an education session containing material that covers such things like the causes of fluid overload in heart failure and the reason for diuretic therapy. It also addresses dietary restriction of sodium and the limitation of daily fluid intake, as well as a rationale for daily weight monitoring, smoking cessation, avoidance of heavy alcohol intake, the use of non-steroidal anti-inflammatory drugs or NSAIDs, and a description of common heart failure symptoms and what to do if symptoms are worsened. It also educates the patient on the importance of follow-up appointments and instruction on when to call a physician, as well as how to set up phone calls associated with to ensure appointments are kept. Several research studies show very interesting information related to African Americans and congestive heart failure. For example, one study shows that African Americans are more prevalent to develop congestive heart failure, and that it occurs at an early age and has a more severe course than in whites, perhaps due to a higher prevalence of risk factors such as diabetes, obesity, and hypertension. These disparities are multifactorial and involve a complexity of interplay between genes, environment, and socioeconomic status. Another thing that this study showed was that heart failure in African Americans should be treated according to the same evidence-based strategies as in the general population, as well as in addition, a combination of isopride dinitrate and hydralazine is recommended for African Americans suffering for congestive heart failure. Evaluation. So in order to evaluate the outcome, we focus on short and long-term progressive program objectives, measuring the readmission rate of African Americans with congestive heart failure. And the impact evaluation measures the immediate short-term changes in awareness, knowledge, attitudes, and behaviors. Conclusion. The success of this community health education plan will lead to a better understanding of the medications used to treat congestive heart failure. Patients will also have a better understanding of proper diet, daily weight monitoring, and common symptoms of congestive heart failure. Patients will also be educated on how to follow with medical doctor appointments, as well as when to notify the physician if they begin to notice that their symptoms are worsening. Overall, this will lead to a decrease in the readmission rate to the hospital for congestive heart failure. References used to create this health promotion teaching plan are listed below.